بسم الله الرحمن الرحيم. الحمد لله رب العالمين، والصلاة والسلام على أشرف الأنبياء والمرسلين سيدنا محمد الأمين وعلى آله وصحبه وسلم أجمعين ومن تبعهم بإحسان إلى يوم الدين. أما بعد، الأساتذة الكرام، الإخوة والأخوات الأعزاء الحاضرون جميعا كل باسمه وصفته، السلام عليكم ورحمة الله وبركاته، وأسعد الله مساءكم أو صباحكم بكل خير حسب تواقيتكم ومناطق تواجدكم. نرحب بالإخوة الضيوف والمتحدثين بهذه الورش واللقاءات المتجددة والتي تنظمه مبادرة حضارم لمحاربة كورونا برعاية مكتب الصحة والسكان بساحل ووادي حضرموت. كما نرحب بكم جميعا المتواجدون معنا بقاعة زوم الإلكترونية والمتابعين معنا عبر قنوات التواصل الاجتماعي، البث المباشر على قناة اليوتيوب والمسجل على الفيسبوك بقنوات مبادرة حضارم لمحاربة كورونا. وننقل لكم السلام والتحية من جميع منتسبي وفرق المبادرة والفريق القائم على إعداد هذه الحلقات النقاشية. كما أنقل لكم أيضا التحية من الشبكة الدولية للتدريب والتعليم والبحث من أجل اليمن انتريم. نحن اليوم بالأسبوع النقاشي 23، نواصل وإياكم مواضيع الورش النقاشية لكل ما يهم الأمور الصحية أو العاملين بالمجال الصحي في زمن كوفيد-19. وموضوعنا لهذا اليوم تم تخصيصه للتحدث عن أولويات التدريب الصحي في اليمن. Health Training Priorities in Yemen. ضيفنا المتحدث بهذه اللقاء النقاشي الدكتور مبشر شودهاري، اختصاصي طب الأسرة بريطانيا. كما سيشارك النقاش أيضا مهتمين بالقطاع الصحي وأطباء وأساتذة من كلية الطب. هذا وسيكون معنا لإدارة الحوار سعادة الأستاذ الدكتور أحمد محمد باذيب، أستاذ طب الأورام والطب الباطني، وهو المشرف العام على برامج المبادرة العلمية. أهلا وسهلا بكم الأستاذ الدكتور أحمد في بيتكم.
حياكم الله. شكرا لكم.
حياكم الله. وقبل أن نسلم المايك لإدارة الحوار، ننوه جميع المتابعين معنا بأنه وللاستغلال الأمثل للوقت كتابة جميع استفساراتهم أو أسئلتهم أو نقاشهم في الزوم الشات الحي أو التعليقات بقناة اليوتيوب خلال متابعتهم، وسنقوم بإذن الله تعالى بنقلها للمتحدث والحضور. هذا وننوه إلى أن الأمسية ستكون مسجلة ومتوفرة بشكل دائم على قناة المبادرة محاربة كورونا هياك. نرجو إبقاء ميكروفوناتكم مغلقة خلال العرض لضمان عدم وجود تداخلات أو انقطاعات خلال حديث المحاضر والمحاور. وبالنسبة لشهادات الحضور فإنه سيتم إرسال رابط نموذج طلب شهادة الحضور بنهاية المحاضرة أو بنهاية النقاش. نرجو ملئها والانتباه إلى صحة الإيميل المدخل من قبلكم، والتأكد دوما من خانة الجانك أو السبام، لأن رسائلنا قد تعتبر في إيميلاتكم في هذه الخانة. سيكون معنا في التنظيم والكنترول بالقاعة الإلكترونية وقناة اليوتيوب كل من الدكتور عمر الخنبشي من ألمانيا، ومن ماليزيا أحمد بحشوان محدثكم. All right, dear sister and brothers, Assalamu alaikum wa rahmatullahi wa barakatuh. Good morning, good afternoon, and good evening according to your local time of watching this discussion workshop. My name is Ahmed Bahashwan, and on behalf of Hadramut Initiative Against Corona, HIAC, and also International Network for Training, Education, and Research for Yemen, Inter-Yemen, I'd like to thank every one of you for being here. I know your time is valuable, yet you choose to be with us, and for that we thank you very much. In this discussion session, we will begin with a few minutes sharing some information about COVID-19 during the previous week, then coming to the main topic of our today's discussion under the title of Health Training Priorities in Yemen, which will be presented by Dr. Mubshir Showdhary, medical doctor at Health Education North East Newcastle, England, United Kingdom. Welcome, Dr. Mubshir, and thank you very much for being with us today. The host and moderator for today's session is with Prof. Ahmed Muhammad Bathib, Professor of Oncology and Internal Medicine. Welcome, Prof. Ahmed. And without further delay, I will pass the mic to Prof. Ahmed to start the discussion session with the blessing and guidance of Almighty Allah subhanahu wa ta'ala.
Thank you very much. شكرا جزيلا. السلام عليكم ورحمة الله وبركاته. As usual, we start with the COVID this week, some information, local and international and local. Worldwide, we have increasing cases of COVID, as we can see from WHO map. We can see that we have almost around 96 million victims, confirmed cases, and we are crossing now 2 million of deaths. And when we come to Yemen, still the data incomplete or not fully recorded. We have now 2,119 confirmed cases and around 615 deaths. When it comes to Hadhramaut, we can see here that we have confirmed cases around 1,012 cases, 582 coming from the coast, while from the Wadi and desert, we have almost 430 cases, the total 1,000 cases. Now, for the death cases, we have almost in the coast 227. We have one case only increased this week, both in the coast and the Wadi. We have almost 116 deaths in the Wadi. The total death cases, we have almost 343 total cases. And Hadhramaut almost participating by 56% of the confirmed death cases in Yemen. We have in Yemen a total 611 cases. And if we calculate it based on the available data, we can say that the mortality rate in Hadhramaut is almost 34%. About COVID news, we can see that there is efforts to achieve the goals of the COVAX initiative, that they are willing to achieve the target of the vaccine coverage. And there are some updates about the deaths in elderly after COVID-19 vaccine. There is some explanation. Last week, we mentioned that we have almost 23 deaths linked to the Pfizer BioNTech COVID vaccine, followed by further 5 deaths alongside 20 serious adverse effects announced on January 19th. We know that there is some responses in this regard came from the French Agency for the Safety and Health Products. They mentioned as nothing to suggest that the reported deaths were linked to the vaccination. And these cases affect mainly elderly people, the very old with comorbidities. Specifically, we have 35% of the people who died were over age 90 years, 46% were older than 80 years, and almost all were over 70 years. So they are reassuring data coming from Europe regarding the mortality mentioned by the Norwegian Medicine Agency. As we mentioned, there is a struggle for the vaccine for the developing countries. For COVAX program announcing new agreement and plans. And they mentioned that almost more than 30 million vaccine doses have already been administered in 47 mostly high income countries, and the wish that we can reach to the poor countries. So 30 millions, most of them in the high income countries. Now, COVAX is therefore on track to deliver at least 2 billion doses by the end of the year, including at least 1.3 billion doses to 92 lower income economies in the COVAX group. So, but the bad news came from India that there is a fire has broken out at the premises of the Serum Institute of India in Pune. Hopefully that this event will not affect the supply, because the main agreement of COVAX is with India in this regard. Again, there is shortage, and the Ministry of Health in Saudi Arabia announced that there is some delay will happen for the supply of the second dose of the vaccine, and they mentioned that giving the dose after 6 weeks will not affect the efficacy, hopefully that. And there is good news from Saudi Arabia. There is a new vaccine with good, efficacy. That means that the main issue in this regard that it doesn't need freezing, and it is going to enter the clinical trials soon. This is by the University of Al-Imam Abdurrahman bin Faisal. And also we have some data coming, reports from Israel that suggest that 1 dose of Pfizer vaccine could be less effective than expected. And these published results have suggested that the efficacy of Pfizer vaccine was 52.4% between the first and second dose, spaced 21 days apart. And data assessed by Public Health England indicated it could be as much as 89% protective from day 15 to day 21. That means the efficacy will diminish. If not given as 2 doses, we have efficacy data that the 1 single dose is almost achieving 54%, 52% efficacy. And there are some data from the Gulf countries mentioning that reassuring about the allergy, that allergy will not affect, is not going to affect the use of the vaccine. So if you have some bronchial asthma or eczema or drug allergy or food allergy, you can still use the vaccine. And there is some experience coming from Indonesia, and they are mentioning, and they opted to give the vaccine, and they gave the priority of vaccination mainly to the to start by the young people, and opposite to all the other countries. And this experience needs some tracing and follow-up, especially after the Norwegian data. They this week they mentioned that we have many types of pathogenesis and reactions to the COVID virus, and rogue antibodies might drive severe COVID. So we know that we have cytokine storms leading usually to systemic short duration problems, while the rogue autoantibodies are thought to result in targeted long-term damage. So now day by day we are starting to know why some patients develop short-timed severe reaction, and the others they may develop longer-term damage. This is the autoantibodies effect. And just warning that COVID may stay in the fecal material longer than the respiratory secretions. We can see here in this diagram that we have many clinical scenarios, and on all the possible scenarios of we can see that the vaccine staying up to, in some cases, reaching up to 27 days after the onset of the symptoms of COVID. So we have to take care of this infectivity and positivity of the fecal material. Again, now the hydroxychloroquine day by day losing its effect, and we can see clearly that we have now enough data that hydroxychloroquine was associated with a slower viral clearance. It is not only, not beneficial, but it may slow the viral clearance in COVID patient with mild to moderate disease. We can see for the clear separation of this, the curve regarding the negativity of the COVID testing. So the use of hydroxychloroquine delaying the negativity. And we have last night breaking news regarding the use of ivermectin, which is inhibitor of the COVID-19 agent, and it is a single treatment able to effect around 5,000-fold reduction in virus at 48 hours in cell culture. And we know that ivermectin is approved by FDA as antiparasitic and therefore has a potential for repurposing. Ivermectin is widely available due to because included on the WHO model as essential drug. So, and was approved for some parasite, but this data still it is in the lab, and we are waiting for the clinical data. It is promising drug really. Thank you, and we'll give the mic to Dr. Abdullah Baradwan to comment on these updates. Thank you. Welcome, Dr. Abdullah.
يعطيك العافية بروف. ما قصرت الصراحة على المقدمة الرائعة. أنا بس يمكن عندي 2 بوينت يمكن أبغى أتكلم فيهم على الفاكسينيشن وعلى اللونج كوفيد. بالنسبة للفاكسين يمكن كلنا we are following the news and the efficacy of vaccine, and you mentioned some data about the efficacy of vaccine, of first dose of vaccine. Now they are, with the shortage of supply of vaccine, there is discussion that why we not give the first dose only for a period of time for the whole people and delay the second dose. As you mentioned, the efficacy is by Pfizer 52% in the after the first dose, but some data maybe say they more than 80%, as you mentioned. So the discussion now is like this. I think the UK, I think they started this, or they are discussing this, and now they're discussing also in US why we don't give the first vaccine, the first dose for all people to protect as much as we can, especially that there is shortage in the vaccine supply, and delay the second dose. It is discussion, I mean, till now. So also there is, I mean, some concern about this, to that second dose. People might understand that the second dose is not needed. So there's a lot of discussion, ethical issues about this. As you mentioned, I mean, one paper from Israel, I mean, if you know that almost by now, they almost vaccinated 30% of their people, of their population. 30% was vaccinated. Indonesia, يعني الصراحة, it is, I don't know, it is good or bad that they will start with the young people rather than the old people. But personally, I think they have a point. Now the discussion, because of this, the discussion now about long COVID, and many times I don't want to talk about this for, I mean, some reason about long COVID, but long COVID now is the maybe the last week, most of the discussion about, I mean, long COVID. I mean, even asymptomatic or mildly symptomatic patient, they will suffer for a long time of COVID symptoms, or what's called post-COVID or long COVID. The main symptoms are respiratory symptoms: breathlessness, fever, generalized fatigability, and what is called brain fog as well, or impairment of the cognitive function, mainly memory disturbance sometimes, and some problem in concentration. So if young people will suffer from this, I mean, for a long time, I think Indonesian have some point, or if they will start with the young people. لونج كوفيد يمكن يحتاج انه نعمل له يمكن مره ثانيه نتكلم عليه بشكل مفصل، لكن لانه الان في كلام كثير على اللونج كوفيد. يمكن الاسبوع الماضي زي ما تكلمنا كله كان على اللونج كوفيد ديسكشن، وكان على الفاكسين ودوز نيو فاريانت، especially South African variant will escape the immunity. في كلام كان كثير عليه انه diminish the immunity, diminished, or the response to the vaccine diminished to the new variant of South Africa variant. So this was probably the hot discussion last week. شكرا يعطيكم العافية.
Thank you. جزاك الله خير. Now we'll give the mic to our main speaker, Dr. Mubshir Abdelrazak Shودهاري. He's a medical doctor at Health Education Northeast and in England, UK, and he's the director of Inter-Yemen. Inter-Yemen is a non-political network working in cooperation with some NGOs in UK, US, and also they are in cooperation with the health professionals of Yemen, for Yemen. And one of their goals is to help in the health sector, health education in Yemen. We are very happy with this initiative, and it is, I mean, chance for all of us to get benefit from this access for education. And I will give the mic to my colleague, Dr. Mubshir, to deliver his talk. Welcome, Dr. Mubshir.
Thank you very much. Alhamdulillah, assalamu alaikum, everybody. Okay, so as I said, thank you for this opportunity for a discussion about the training needs survey that we completed with the help of colleagues in Yemen in December. Now, this is not a lecture, as I mentioned on the group yesterday. It is a discussion with our colleagues in Yemen. So I'm hopeful that the host will allow people to unmute themselves at the appropriate times and to be able to give their views about our results as well. So what I'd like to discuss today is briefly the methodology that we used for this survey, a very brief critique of the survey, a discussion of results, and then this will take most of our session. We do have lots of results from the survey, but I want to just focus on 20 particular results today, because otherwise it will take all weekend. Once we have our discussion, I'd like to possibly start thinking about what the training priorities will be and mechanisms for delivery of training. And finally, just about an update on the educational conferences we've been discussing with some of our colleagues from Yemen as well. So just a brief introduction about three of our colleagues. Myself, I'm Mubshir. I work in family medicine in England. I'm also the project director for INTEYEM, the International Network for Training, Education and Research for Yemen. My colleague in this is Wahib Al-Azan, who works in orthopedics, who's the project coordinator. I think joining us today also is Dr. Wissam Al-Sakaf, who is a hematologist, who's also the chair of the Professionals for Yemen charity as well. And we're all part of an association called the Health Professionals for Yemen, which is about almost 100 clinicians who all want to help Yemen in some way, either through training, education, or resource transfer. So onto the training survey. My understanding of how to do a training needs analysis is really teleological in the sense that we need to understand what is the purpose of the training. And if we understand the purpose of the training, then we can understand what kind of training is needed. So if we said the purpose of training is to improve the skills of clinicians, then we can say, what is the purpose of improving a clinician's skills? And then we could say that the answer to this is to become a better doctor. But then what is the purpose of being a better doctor? And then we can say the purpose of this is to treat a disease more effectively. And then what is the purpose of this? So ultimately, to make sure that our patients have good health and that they are able to function as good members of society in our community as well as they can. Now, ideally, we'd work backwards from the patient, back to the doctor, back to the purpose of training. But unfortunately, what's come through from a lot of discussions with colleagues from Yemen is that there's a lack of epidemiological data about the patient's diseases and the health priorities there as well. So unfortunately, we can't work backwards in this scenario. So the rationale for this survey was basically to understand a snapshot of what doctors and other clinicians in Yemen understand about their clinical training needs, and from the survey to feed into a larger analysis of the training needs of our colleagues in Yemen. So basically the methodology, just an outline of this. It was a rapid survey of any health professional in Yemen who wished to take part in this. We used an online survey format with Google Forms. We translated the questions into English and Arabic. My Arabic, as you know, is not the best, so I asked colleagues to check the translations. And the questions were broadly in two categories, either background to respondents to give us an idea of who was answering the survey questions, and also their training experiences thus far in Yemen and outside Yemen, and what their future aspirations for training were. Overall, 63 Yemeni healthcare professionals responded over 2 weeks. Now, unfortunately, we haven't got time to go through all of the data, so I'm going to skip that if that's okay, and we can come back to it at a later date. Basically, some of the critiques, and there are lots of critiques of surveys, and this survey in particular. Firstly, how effective was the dissemination of the survey? So we use our own contacts in Hayak, for example, and other, the hospitals across Yemen, but we did not obviously reach every single. We don't give every single healthcare professional in Yemen the opportunity to respond. And obviously, the respondents were self-selected as well. They may have their own agenda for responding to each and every survey. Another critique is that the survey relied on access to internet, and we know that some parts of Yemen have a poor internet infrastructure compared to other parts. Therefore, that was a bias as well. And of course, there are political and cultural sensitivities attached to any survey and respondents, especially in the current climate in Yemen. Furthermore, there's a small sample size, 62 compared to the number of healthcare professionals in Yemen. It is obviously quite small. And from this, there can be difficulty in generalizing the results to the healthcare workforce in Yemen as a whole. Also, in terms of the actual design of the survey, it's difficult to know the appropriateness of the questions as well. Sometimes we do have our own understanding of what healthcare in Yemen is like, and we have been to Yemen before, but obviously people who work in Yemen all the time will have different understandings of their own context to what we bring back to England. So there are critiques, and they are very valid critiques, and this is just a snapshot of healthcare professionals' views. It's not a definitive answer at all. And it is just a basis for discussion more than anything else. So just to reiterate, there are approximately 100 questions, and thank you for all those who answered those questions. But not all the questions were for all respondents. So some questions were for nurses specifically or midwives specifically. Others were for other healthcare roles. And I said there were various different questions in the survey. So what I'm going to do now, I'm just going to focus on a few slides. Okay, so the first slide obviously shows that how many of our colleagues had actually taken part in any training whatsoever in the last 2 years. And the majority had not taken part in any training whatsoever. It's obviously quite concerning with the rapid changeover in medical and clinical knowledge. That's the first key point from the survey. So we'll come back to how valid these are afterwards. In terms of the format of clinical training, most training still is classroom or lecture based, although it is reassuring that a lot of training is now conducted online, which means that there are advantages to access for healthcare professionals across Yemen. The format of clinical training obviously depends on the type of skills training we try to develop as well. So we need to think about who responded to the questions, and we can go through that again later on as well. The focus of training, again, understandably, was mainly clinical skills, followed by teaching and education skills. Research skills are about 13%, as were professional skills. So understandably, clinical skills remain the priority of the training that has taken place over the last 2 years. Now we come to the main factors that encourage our colleagues to attend training. Now the most important factor was having a knowledgeable trainer. Obviously, the trainer who knows what they're talking about and who is an expert in the skills is very important. And that was the main factor that our colleagues were looking for when they were choosing a training course to attend or not. Again, having the skill is important. If that skill is unable to be communicated, then it has a limited utility. So the second main characteristic for attracting participants was that the trainer was a good communicator in imparting his skills and knowledge to the participant. Thirdly, it's important to think about different learning styles for our learners, and people acknowledge that they may learn different learning methods. So to have that variety of training methods is important for some people as well. Again, interactive training is important. Now, receiving a certificate, and obviously it is important to have recognition for any training that we've undertaken. It is still quite important for many people as a motive for going to a training session. Understandably, a lot of people still want their colleagues to attend with them. Maybe they help them learn better, maybe they feel more confident with their participation, maybe they feel more reassured about who they're participating with, although it isn't obviously the main factor. And for some people, it's not a factor at all, as in they give a very low score. The logistics of attending training are a reason for deterring people from attending. Now, obviously, we know that Yemen has got the issues between the north and the south now, and maybe traveling between the two areas is more difficult. Even, for example, maybe people who've got families, it's difficult for them to leave their families for too long a period of time as well. Again, price and cost of attending, not just the course itself, also the cost of hotels, of travel, is very much a deterrent as well. Now, coming back to the actual workplace problems that staff face when attending training, shortage of staff is unfortunately across the globe an issue, but it seems to be more of an issue in Yemen, that people just can't get time off because there's not enough people to cover clinical duties. And this is a problem for them to attend training. And again, also the issue of maybe a lack of understanding about the importance of training from managers being an issue for some people to attend training as well. Family commitments are important for some people. Again, maybe accommodating study leave in the workplace is difficult. Maybe some people feel like they have to use annual leave instead, which is obviously quite precious, and they want to use it for other commitments as well. The relevance of course is of course quite a deterrent as well. If the course that you need is not available, then you will be very reluctant to attend, and people will not want to attend just for the sake of attending unless they feel like they need a certificate just for their CPD portfolio. So I'm going to just stop there if that's okay. And if it's all right with you, Professor Ahmed, I'm just going to ask people for their opinions about whether what we've discussed so far is real or not real, whether just a biases of a self-selected group. What are people's opinions about, for example, not attending too much training in the last 2 years?
Let's hear from Dr. Ahmed Maashar.
Hello, assalamu alaikum.
Wa alaikum assalam wa rahmatullahi wa barakatuh.
Yeah, thank you for inviting me to attend this interesting subject, to be honest. So thanks for Dr. Mubshir. And do you want me to answer the question here, or what's it?
Yes, please. Yeah, if you could just give us your impression about the result, whether you think it's an accurate result or whether you think they're... Yeah,
of course. You know, I'm not living right now in Yemen. I'm living in UAE. Actually, we have always here a CME, continuous medical education hours we need to attend every year. So this is part of mandatory requirements to get in our work. And in fact, this is not the case in Yemen. Training doesn't mean, you know, because now the meaning of training is different during COVID time. We can't get the training even with the Zoom. You should not travel to get the training. So the online training is part of the of getting the education or the skills if it's needed. So you did not focus on that part in your study, right? I mean, you can get the training based on the online courses or something like that. And regarding the questionnaire here, that's affecting also part of Yemen or the specialty or the, let us say, the entitlement. So general practitioner, he might get difficulties different from the people who are like consultants, because maybe they get more paid and they have more time. In another aspect, other parts of Yemen are different. I mean, maybe people in Aden or in Sana'a or in Hadramut, they might have different accesses. You listed a lot of, like the causes of not getting the training. The training doesn't mean only just to go abroad. Some people, they might do local training. Like, let us say there are small courses there to attend, because people, they get from abroad to do some workshop or training courses. So they might attend it, because it's not only to travel abroad. So yeah, in general, I mean, these the things I just went through. And some people also in the university, they might have access to do training different from people who are working in the local sector or in the private sector, let us say, or in the Ministry of Health. The list of the difficulties you put in your questionnaire, sometimes it is all of the above, like money, time, difficulty to access. So this might contribute a little bit in bias on which one is the more affected thing, because all these three major factors are the major obstacles to get the access or to do the training. Thank you very much.
Thank you. So we'll go Prof. Amin Bawazir.
Thank you very much. First of all, I would like to thank Dr. Mubshir, as well as all the attendees in this good session, inshallah. Indeed, I have a little bit, some comments just only to raise it. First of all, regarding the survey by itself, to what extent the total participant, I think, if I'm not are only 63. So if we compare this number of 63 to the total number of the healthcare providers in Hadramut, if, for example, this is the survey was done there, so how much is the rate, we can say, or the percent of those, the surveyed people? Second thing, also, I agree with Dr. Mubshir that training and attending some courses nowadays in the way of COVID is also different totally. Sometimes it's just only in the same province, or what is called the city, or either through the internet, and then it can also reach. So I don't know if this also included in the survey or not. However, I have really, a little bit concerned about the survey by itself. To what extent this survey was validated survey? That means, conducted in other population, or on the same, population in Yemen. And of course, we ensure the consistency as well as reliability of the contents of the questions, to what extent it is understandable or not. So these are issues. The last one, I'm not underestimating the results, but I'm just only mentioning something that could be improving such surveys in the future. This survey was conducted specifically in a critical time, which is the time of the internal conflict in the country, which sometimes does not, reflect the real situation regarding the training and so in the country. For that reason, I raised certain, what it called, just only issues in order to be considered for conducting such surveys in the future, inshallah. Thank you very much for your great work also. Thank you very much.
Dr. Mubshir, do you think that we have to, show the survey conclusions? I have, if you don't have it, just to refresh their information about the end result of the survey. I think very important. The summary is important.
Yeah, so thank you. They're all very valid criticisms, and I agree with them all. So firstly, in regards to having specific training for different roles, absolutely, we do need to think about this. the geographic area of Yemen does affect what training is available. I completely agree with this as well. The timing of the survey with the conflict, with COVID, everything is against having an accurate assessment of the training. And again, the small sample size, as I said earlier. I agree with all of these critiques. As I said, this is just a snapshot, and it was not a trial survey. We did not look at the questions with participants in Yemen before rolling it out. We just did not have the opportunity. But these are learning points that, and from this session today, we are hoping that we can maybe go forward and have a more comprehensive training needs analysis with other information coming through and having a program together, rather than just focusing on this survey itself as the complete answer. And I completely agree, it's not the complete answer. What I just wanted to do actually is, if we just move away from the actual questions, just look at some of the responses themselves and see what the reason for these answers are, if that's okay with yourself. So, for example, we understand that travel is an issue for people to go to, and online training is definitely an option. From some training, for example, practical skills training, maybe having in-person training is more effective than having online training. And if travel is too much of an issue, how could we possibly overcome this issue, do you think? And similarly, if we go through the other ones, expenses to attend, shortage of staff at work, permission from managers and family commitments, how would we overcome these challenges in online and non-online training? Can I open the floor for that question, Professor Ahmed?
Prof. Khalid Al-Saremi, can you comment, please? Prof. Khalid.
Thank you very much. I just joined you now, but I don't know. Maybe I missed most of the presentation. But from my quick understanding, we might go with a combined strategy. We cannot have answer that online training will be enough or not. This will depend on the availability of the training. Because what's really available nowadays is online training. And I think we might do what's called post-assessments. And I believe in-person training because it creates a kind of actual communication and interaction with the trainees. But well, I will suggest to invest, especially this year, if there is any opportunity in online training, because we still have a problem with the COVID. And from that, we can roll out the other alternative in terms of person training. So if can I go with suggestions, let's do, for example, 80% of the training online and 20% in person, depends on the availability of the resources and the circumstances. I think one point is, I'm not sure if it has been addressed or not in this presentation. It's about we should not go further doing such kind of advanced studies, because as we know now, we need to build the capacity for trainees in Yemen, which we might start with them doing the simple design. Maybe it will be good to build the capacity of the observational studies, different types, cross-sectional, case control, cohort study. And then later on, we might do some experimental studies. And I would really recommend that we need to have a team of training who can build a mix of methods, especially clinical training plus basic science and public health, because this is the only answer for our challenges. Unfortunately, COVID-19 told us that we are a broken system, it's fragmented. So if there is any training and building capacity of the research, especially for Yemen, we need to combine at least 3 areas of training in one. If possible, especially online, it will be easy to do that. Sorry, this is just a reflection on what has been presented. I just joined because distance time, I'm joining you from the United States, and for us it's still too early. Thank you, Prof. Ahmed, and thank you, the presenter.
Welcome. Dr. Ala bin Duhri. Dr. Ala.
Good afternoon to all of you, my colleagues and my professors. It is really a great opportunity to join you in this webinar. Many thanks for Prof. Ahmed and for all modulators, for our great speaker, Dr. Mubshir, for his great endeavors which is done in this survey. Thank you for Hadharm initiative for combating Corona or COVID-19. I would really like to share with you, Dr. Mubshir, some other surveys which have been conducted here in Yemen in 2013 and 14. I am really concerned about mental health services. Therefore, we have conducted a survey to know what are the obstacles and what are the main reasons for improving mental health services and addiction services in Yemen. This is the title of this survey, Collaborative Business Plan for Developing Psychiatric and Addiction Services in Primary Healthcare Services in Yemen. Our main concern in this, or our main objective is disseminate comprehensive, preventive, and rehabilitative psychiatric and addiction services in primary healthcare centers, and to decrease the waiting list to receive services for less than 48 hours. The methodology for this survey was this descriptive cross-sectional study, and it was nested with quality improvement protocol of 6 Sigma, which start with define, then analyze the reason, then measure, then improve and control, or DAMYAC. Our main result, which has been come from this survey, there was more than 20 reasons for delaying or obstacles in accessing services. And we have make a storming sessions and a pilot group to summarize these reasons in 5 main categories. This has been, the first one is lack of training programs or lack of official training programs or accredited training programs in Yemen. The second one is lack of availability of well-trained psychiatrists and clinical psychologists, which is nearly a knowledgeable trainer, as you mentioned in your slide. The third one is lack of psychiatric and addiction services in the local community. Psychiatric services in the local community in Hadhramaut is almostly absent in most of the regions. And even until today, there is no one official hospital which is caring for or provide specialized services for mental or addiction services in all the south regional part of Yemen. The fourth reason was a lack of policymaker recognition or corrective action. Until today, we do not have Mental Health Act. We do not have a law to organize or make arrangement for practices of mental health services in Yemen. And the last one is lack of standards of good psychiatric practice or clinical practice guidelines. This survey has been conducted in almost 390 healthcare professionals, which is, as Dr. Amin said, corresponds to 10% of officially registered healthcare professional in Yemen. And it was a convenient sample. The first one who received the survey, it was an online questionnaire, and it was shared also in all the WhatsApp groups for medical healthcare professionals. We have collected 90 respondents from all the area in Hadhramaut, Wadi, and coastal region. And as you see in this Pareto diagram, as you know, that in this quality improvement project, we are then summarize which are the main 2 reasons which, if we really make some improvement projected on them, will almostly solve 80% of this problem. And fortunately, the first 2 was really related to the training priorities. The first one is lack of training program, and the second one is lack of availability of a knowledgeable trainer, which is corresponding to 80%, as you saw in this Pareto diagram for this study. Therefore, our improvement project was to make a collaborative business plan for providing training programs and to introduce such services for family general practitioners, which are or master program which has been conducted in Hadhramaut University, to attach them here in Kingdom Saudi Arabia, to attach a 6-month rotation program in our hospital here. All the logistics at that time has been arranged. There has been waiving from the training fees here, and also we have being able to provide accommodation for people here. But as you know, when 2015 come and the conflict or the war start, all these projects has been suspending, and all the budget has been diverted to refugee programs at that time. I think this is what I have I would like to share with you, and really, as you will see in this diagram, really the lack of training is one of the most important obstacle now in Yemen, which is delaying or which really prevent access to all services, among them the mental health services. Thank you, Dr. Ahmed, for this opportunity.
جزاك الله خير دكتور علاء. Very impressive data and well organized. Dr. Ala, in few words, what is your recommendation regarding the mental health training in Yemen? Because Dr. Mubshir is willing to concentrating mainly on mental health, and even the conference they were planning to make it by taking the topic of the mental health as priority in Yemen. What is your priority? You need more doctors in serving this field, or you need more allied team, or what is your priority?
Unfortunately, Dr. Ahmed, regarding mental health services, until now there is no official registry for all qualified healthcare professionals in Yemen, and the official reports which come from the government is still really deficient in many main or core informations that we need. But as you said, I think the most important or the most prevalent way which will ease the access of mental health services is to introduce these services really in primary health care. Dr. Mubshir has a great experience in work in UK, and he know that some of consultants, for example, child adolescent, general psychiatry, or addiction therapists, sharing some days in their schedule in primary health care services to facilitate the introduction of these services, as we have been done one initiative in Cardiff in Wales with Dr. Tayyib Tahir, if you know him, Dr. Mubshir, which is located in the University Hospital Wales at that time. Therefore, really, this reduces the time for accessing mental health services, decrease the stigma associated with going to specialized mental health services, and make direct supervision for a general practitioner there to provide more services and to be more confident in dealing with a patient which is coming to a primary care trust there in United Kingdom. I think we really need to emphasize and focus on increasing the capacity and the effectiveness of primary health care physicians to deal with mental health issues in Yemen.
Dr. Mubshir, you have any comment?
No, that's fine, thank you. I mean, that's all very, very useful information. I wasn't aware of this survey conducted in 2013. I'd be grateful for Dr. Ala if you could email me this afterwards so I can go through this as well. And as you rightly said, I think one of our colleagues earlier said, it's about having a tangential approach to understanding what the training needs are, having different sources of information, anthropological, surveys, Ministry of Health data, and then trying to put this all together and try to understand how to go forward. Mental health is in crisis in almost every country I know of. In England, it's poorly funded as well. It's less resourced, and a lot of our emphasis here on mental health training here as well is moving from secondary care of psychiatrists to general practitioners, family physicians, for them to undertake as much as possible if they can. But yeah, I agree that if primary care health doctors are more more aware of mental health diseases, then it can take a lot of pressure off secondary care services, and that is probably an important priority. If Dr. Ala, if it's okay with you, I can communicate with you afterwards as well, and maybe just discuss this in more detail if that is okay.
Great.
It's my pleasure, Dr. Mubashir. Inshallah, after this webinar, we will be in contact.
دكتور عبد اللطيف الواقدي، تفضل دكتور عبد اللطيف. اهلا وسهلا.
السلام عليكم.
السلام ورحمه الله وبركاته.
حياكم الله. اعذروني التغطيه ضعيفه، ما تابعت كثير.
He's talking from Yemen.
يعني بالنسبه طبعا حاليا في صنعاء. نعم.
He's in Sana'a now. Yes.
I'm sorry, I just joined later to this important course. But what I need, يعني from my observation in the last 4 months here, the training process is very important and should be prepared. Preparedness for training should be well established, and also the selection for trainees is very important, because in some many trainings I saw, the selection is based on, yes, they are working, and it's just done in many times to receive some incentives. So the quality of training should be also reviewed and well prepared. So this is my main observations lastly here. If there is any question in the fields, I think every field in Yemen is in need in training.
Dr. Abdul, you think that it is doable to conduct virtual meeting with this net status in Yemen, because our main target mainly the staff there inside. So with this net situation, is it doable to conduct virtual meetings?
Virtual is very hard because the internet coverage here is very bad, not stable. Maybe if we can make visual training, and later we will distribute it, it will be more practical. But this also need to someone to stay during this training, because there is a huge problem in the net connection in Yemen now.
Okay, thank you. Dr. Rasha Bazghefan is a family medicine doctor. She can also give her feedback, or ideas regarding the training, especially for the family medicine doctors. Dr. Rasha?
Hello everyone. Thank you for giving me this opportunity. I would like to talk about the main obstacles that are facing the family medicine. We are facing, as I practiced in Yemen before 3 years, we are facing, there is no enforcement the rule of the family medicine and the health systems. So we are, this is the main problem. We have a lot of power, we have a lot of knowledge, but there is no rule of a family medicine, and there is no rule of the referral system from the primary health care and to the hospital. I think this is the main obstacles in Yemen. About the training, the awareness of the general practical and the family physician about the medical ethics, it is too low. I think they are need more awareness. We are needing more awareness about the medical ethics, about the patient safety. This is I want to focus on these 2 points: the role of the family physician as in healthcare system, and the medical ethics. Increase the awareness of the medical ethics among all the health staff, and especially in the primary healthcare doctors and family physician.
Thank you, Dr. Rasha. Dr. Mubashir, you have any comment as family medicine also, Doctor?
Yeah, no, I think that's, the context of family medicine in the UK will be very different to what it is in Yemen. I've talked to Dr. Rasha just a few days ago, and she has already outlined some of her advice about improving family medicine. And it is quite a relatively new specialty for Yemen as well, and it will take time for it to grow and to become established as well. And it is very important to know where family medicine begins and where it finishes, and when then secondary care stops, and how to have that effective relationship between the two. And I will discuss this more deeply at the conclusion of the lecture, because we're having some online conferences as well after discussing with colleagues in Yemen. So I'll discuss that more at the end of today's session as well.
Thank you. Well, I think that nursing training is have the priority really. The nurses are the missed part in all the training efforts. And if we have, I think they should organize themselves in order to find the ways for more and more educational activities. Okay. Anyhow, the floor is open for all the comments. Prof. Khalid Al-Saremi.
Yes, thank you very much. This is me again, Khalid Al-Saremi. I reflected on the answers of colleagues. It's really important. One of them from Dr. Abdul Latif, I think what he said is really very important to be taken consideration about the challenges in Yemen in terms of internet. But what my suggestion is, instead of relying on conducting virtual training completely for those who are in Yemen, we might be pragmatic. What we can do, we will do connection those people who have Yemenis doctors outside Yemen. They work as a mentors, and those who are in Yemen as a data collector at the beginning. And then in the training, we bring them together. What I'm trying to say, we should not only train because I would like to be action oriented. We don't want only train people theoretically. We need to end with proposal. This proposal should be led by a qualified professor who can supervise those who are in Yemen. And then we sure that those who are outside Yemen as a Yemeni doctor, they can push things forward because they are an advantage of the internet. So what I'm suggesting is, if there is any training in the future, we should make sure that we have trainees from inside Yemen, and we have also some trainees, especially those resident students who are outside Yemen, interested in the research. So at this, we minimize the dangerous or the negative impact of what's going on in Yemen. Second point, in terms of, you mentioned, Dr. Ahmed, about the nursing, the physicians, the lab, etc. Personally, I don't believe in territories. That means we train nursing alone, separate from physician, from a lab technician. In terms of training, will be the similar training for all of them, and they should be in the one class, virtual or in person, because this is one of the issues that health system in the world is facing. It's fragmented system. So please, if you have any training in the future, bring together in the selection criteria from nursing, from medical care, from paramedical, from etc. in one training room, and then they will pick their topic. It might have, for example, one of the colleagues said about patient safety. Patient safety, it could be addressed from nursing. I can give you one example from my area. Medication safety. It's about prescribing the medication from the doctors, and it's about administration of the medication from the nurse. So, and we might bring even pharmacists. So one issues could be tackled from different perspectives. So my suggestion for those who are gonna build this kind of training in the future, because it seems from your presentation, training is a big issue. It is bring people who are related to health. And final point is, we should not ignore the situation in Yemen. In other words, we need, when we have any proposal, we need a sponsor or partner from College of Medicine, College of Nurses, somebody in Yemen, plus somebody from the Health Affairs as the Ministry of Health or their offices. So if you have these three stakeholders, Ministry of Health representation, college academia representation and us as a science scholar there, I can assure you we will make a huge difference. We will transfer knowledge, we will generate knowledge and transfer this knowledge to action and policy. So this is the 3 points I'd like to emphasize, because it seems things is moving forward, and I hope things will be in the good shape in the future, and we are more than happy to help for any kind of things in the future. Thank you very much for all of you, and it was a pleasure to join you actually, because now for us it's still early in our time. Thank you.
جزاك الله خير بروف خالد. طبعا احنا we are talking in general, including and concentrating mainly on the clinical skills and professional skills. It is not research training. So for that, when we talk, we have to give priority for the nursing training, because they are they are in real need, and we are talking not regarding the research. It is matter, comprehensive training, and mainly for the professional skills that may save life. And the nurses, they give very nice feedback in the survey. For midwives, for example, they are thinking that they are in need for newborn resuscitation, and to recognize the newborn, the sick newborn, and the warning signs, alarming signs in the pediatric care. So what I mean, it is matter of, more comprehensive training, not only research. دكتور أحمد معاشر تفضل.
Assalamu alaikum. Thank you very much. I've been in Yemen before. I'm now in the United Arab Emirates. So the problems which I can tackle, actually, to be honest, is there is lack of ambition, or let us say there is no proper training program in Yemen. So there is a problem in Yemen right now. So there is, let us say, extraordinary problems need extraordinary solutions. So based on what we did before, which actually been like rewarding, there are some anesthetists came to United Arab Emirates. They have some training courses here, and then they went there to be the trainer for the trainees. And same also happened for the trauma. I've been involved in trauma courses in Sana'a and Aden, in Hadramut, regarding teaching the people how to deal with the trauma cases. And these courses, they are very short and very beneficial to all the people attending these courses, because you cannot send the people abroad to get the training unless they will be the trainer themselves. So starting, like from the initial parts, like the intensive care unit, just one attending a course and go and train the other people for the ACLS, ATLS, even the BLS, this will be a good starter. Other things which is also I've been involved in doing, like, surgery missions in Yemen, in Hadramut, like myself. I've been there and also trained some of our local staff surgeons there to do the lab chole, and they are doing it right now. So this part of training the people is a very crucial part, because this is the only way how to do it. Plus the online things, which is because of one of our colleagues said there is difficulties even to get the internet, proper internet there. So, we can't start with scattered, let us say, efforts from everybody, but at the end we have to build up a system how to do this and sit together, maybe in another Zoom meeting, everyone in his own field. Like I'm in surgery, I might interested in doing like some surgery and other trauma, and other people, they will talk about the ICU. And you can't do it like in different time with different people in different places. And also you have to inform these people that they have to attend. Like myself, when I go there, maybe you will not see a lot of people. Maybe they don't show interest to attend all these courses, or to have any skills at that time. Thank you very much.
شكرا جزيلا. Dr. Mubshir, you can give a reflection for the previous talk.
Yeah, thank you very much. They're all very useful comments. I think we can discuss this the whole weekend, and unfortunately we don't have the time to discuss it. We do need to be a bit more focused about what we want to achieve today. They're all very valid points. I think if I can just ask 3 questions, and then before we start moving forward. So I'm just sharing the slides. So the first question is, which job role or which job roles in Yemen are most in need of training? So most of our colleagues on this call are doctors, understandable, but there are lots of other healthcare professionals. You mentioned nurses, midwives, pharmacists, occupational therapists. Which of these roles would be the most beneficial for patient outcomes to focus on? This is the first question. The second question is that there are lots of different specialties as well. Each specialty obviously wants its own training to be at the forefront of any program. But to make the most impact on patients, which specialty would need the training first or most training? And the survey showed that, it is a snapshot, that the specialties that needed most training were emergency medicine, critical care, public health, infection, and cardiology. But is this an accurate assessment? I'd like to get your opinion about that. And then once we have an idea about which roles and which specialties, then we can maybe start focusing on training. I think one of the speakers earlier said it's very important to have proposals from our colleagues in Yemen, because they're the ones who best can assess what training is needed, and to work in collaboration with the Ministry of Health, with medical schools and universities, with people who are practitioners and people abroad, to have a joint proposal about how to, so what training is needed and how to achieve that training. It's not very useful for us to have a unidirectional training where we say that you need this, you need that, because we don't know what you need. We know what you need only by you telling us what you need, and if it's realistic, if it's practicable as well. And also we need to think about what resources are available to fund training as well. So I appreciate UAE has much more resources than Yemen. They can afford to take an anaesthetist out there for a few weeks, months, even years to train local people. Whereas people in the UK, our trainers would be doing the pro bono, as in they won't be taking any money for it. So they'll be limited to maybe 1 week or 2 weeks maximum when they come out to Yemen. And how much of that actually needs to be done in Yemen? For example, skills training for surgical skills or anesthetic intubation skills will need to be hands-on. How much of that can also be done virtually as well? So 3 questions, Professor Ahmed, if you can open the floor. Which job roles are most in need of training? Which specialties are most in need of training? And then later on, maybe we could discuss what training is actually required within each of these roles and specialties. Thank you.
Okay. Dr. Ala bin Duhri, can you comment on these 3 points?
Many thanks, Dr. Ahmed, for giving this opportunity. I am a consultant of psychiatry and addiction medicine. Therefore, always my input will be concerning mental health services. As for from our side or point of view from mental health providers, really there is a very lack of social workers, there is a very lack of clinical psychologists, and there is a lack of ex-addict or the previous addicts who are supervising, conducting addiction programs. Doctors also, or the qualified doctors who have, there's no, until now, any master degree in Yemen for mental health services, and the candidates who are accepted every year in Arab board, they are 2 or 3. And until now, for example, in all Hadramut, Socotra, Al-Mahra, and Shabwa, there are less than 10 qualified psychiatrists available there. This is regarding Dr. Mubshir, the first thing. And therefore, when we have planned for our collaborative plan, it was including psychologists, 20 psychologists, 20 social workers, and we have a plan with nursing university with Dr. Abdullah Al-Hanshi for make official training for internship of nursing graduates in Kingdom Saudi Arabia here. And we have make a plan to accept or accommodate about 40 nursing graduates to conduct their internship year here in Saudi Arabia. Therefore, really without integrative or without a multidisciplinary qualified mental health providers, you cannot really provide a good quality mental health services there. I think this is the first questions, Dr. Mubashir, you have asked regarding who are in most needy for training at this time. Because really one hand cannot slap without others. You cannot be just doctor without clinical psychologist. You cannot do the work of a social worker. And really you will not have the experience of ex-addict to provide a day-by-day program for recovered addict. Therefore, really, I think there is it is reductionist to see just who are in need. All are in need because the gap really is very big. But according to our limited resources, we need just now to select the people who can provide services in the near future, because really the gap, especially I'm confident in talking about mental health services, is very deficient in Yemen. And you cannot, even if you have some psychiatric patient in crisis, there is no one official governmental center who can accommodate this patient. I hope I have given some information regarding your questions, Dr. Mubashir. Thank you, Dr. Ahmed, for this opportunity.
You're welcome. Dr. Ahmed Maashar, from surgical point of view, يعني, can you give your thoughts for Dr. Mubashir regarding the training of the surgeons? You mentioned already the the issue of life, BLS, ATLS, and these things. But regarding the skills, how can we conduct training for the surgical skills hands-on in this situation? Any suggestion? Any?
Yeah, actually, thank you, Dr. Ahmed. Yeah, there is one point actually, and need to be sponsored if we get any chance to get sponsorship for these things. You know, now for the surgeons, you have either open or laparoscopic surgery, and also for the courses as well. The courses you can't conduct it. We have just Manican, and you have just one of the trainers who should come there and teach the people. So it's not need a lot of, like budget. But at the end, maybe later on, you have to have all this certification or the accreditation from the other international society. Regarding the surgical skills, laparoscopic surgery, you have always now, all the time, you have all these, the Manican or the laparoscopic training box. You can afford it and starting doing this, even in the, for the internship, like during the early time. So this will help the people to start the basic of laparoscopic surgery. And when we do this charting mission, which we are doing it now, when you go there, any local surgeon there, he can starting like doing the surgeries under supervision, and this will improve his skills. And later on, this will be like another step to teach the other people. For the emergency or the advanced trauma life support, I think these things need to be organized with the people from all the societies, from the university and the Ministry of Health. The trainers, they will come from abroad, like we did in Sana'a and in Aden, and then they can do the course like one or twice, and then later on they might get the accreditation. We'll have a center there in Yemen, and this is like an ambition. We worked for it for a long time, and unfortunately not happened yet. Thank you.
Okay. Dr. Maher Al-Attas, you connected now?
Assalamu alaikum.
Wa alaikum assalam.
Sorry, an incident happened here.
Alhamdulillah.
But everything is okay. Okay, well done. And I don't know, I don't hear a lot of things, but I heard the Dr. Chaudhry, what he talked about yourself and Dr. Maashar at the beginning. And now at the end, half of it. Anyhow, Yemen, at time they need everything, including training. Okay, we should not have to be more optimistic to deliver all type of training at this time. Okay, so what I believe myself from my experience as a surgeon or as what I tell you, experts somewhere in healthcare administration, I believe in hands-on training. Hands-on training for those who's working in service should be a continuous process. And this has been approved worldwide. Education, practice should be all the time continuous in the service. So what Yemen, I believe at this time they need, if we classify the need of type of training, they need pre-hospital medicine. It's zero in Yemen. Most of the death, because they bring patient after accident or after MI or after at the hospital almost in bad condition or dead. So we should have to emphasize on pre-hospital medicine. Most of the medicine practical in Yemen is acute medicine, so we should have to go and to look for short courses in acute surgery or medical medicine. And I believe infectious disease at this time, it is mandatory in Yemen. We should have to do something in it. Okay. A lot of problem to deliver what we want, it's difficult. Okay. I believe now a lot of online courses, okay, will face internet problem in Yemen. We can make recorded courses, I can send it date, all this. The most important thing we should have to think for the short time to look if we have already instructors in short medical courses, which is accredited internationally, like ARC. Maybe our main speaker, he's from UK, and maybe he has a way to get some instructors in these short courses which had on referring ARC, like has been mentioned, BLS, BALS, ACLS. This will help us to start to do some training. And if we got outside and inside a group of these people, we can join these people together out of Yemen, near Yemen, or a country which they can come easy from Yemen to it. And we can start to do something till things will establish in Yemen, either from more wide point of view or from COVID-19 other restrictions. This is what I believe we should have to do it regarding the training. And thank you for very much. I don't know what is the capability of Dr. Shودهاري and his team to deliver to us. He is now making survey, but what's his capability? What he can deliver now for us?
Yes, Jazakallah khair, Dr. Maher. We can hear from Dr. Mubshir what he is.
Dr. Ahmed, just can I make one comment, please? I need just to share the screen just for one. As you know, now we are making one research regarding the impact of our psychological impact of COVID-19 on healthcare workers in Yemen. We have taken about 812 healthcare professionals, and as you can see in this last table, for example, for PTSD, about 35% of healthcare workers in Yemen can be diagnosed now or have some major criteria to be diagnosed as having PTSD. I think one issue that we need really to focus on is the mental and the physical health well-being of our healthcare professionals. They are really practicing in very bad situations. They do not have supervision or mentoring from from senior healthcare professionals, and they are really fighting without any arms in the field there. Therefore, just really, as the burden of mental health now is very big for all population in Yemen, healthcare workers especially need special attention for their physical and mental well-being. Many thanks, Dr. Ahmed, for giving me this opportunity to share this point.
You're welcome. Dr. Mubshir?
Yeah, so just thank you, Dr. Ala, about the previous speaker's comments. Yes, in terms of the priorities for training, so that each specialty will have its own particular lens for viewing the priorities. For example, Dr. Ala mentioned psychiatry and mental health issues, and to have a good skills mix within mental health services. Surgeons will have their own understanding. It's very understandable. In regards to pre-hospital emergency medicine, pre-hospital medicine, I'm not sure what training paramedics already have. If there are paramedics in Yemen, what kind of resources they have, and what kind of how would we deliver that training, because a lot of it is hands-on, it is practical training as opposed to just being theoretical. Again, acute specialties, acute medicine, surgery, I appreciate that, and accreditation is very important as well, and we are discussing with the Royal Colleges here about accreditation for our training courses, inshallah. In regards to our resources, as I mentioned, I think in the group previously, InterYem is about networking. So what we do is we try to collaborate with our colleagues in England. Now, Health Professions for Yemen is about 80 doctors from Yemen, or many doctors from Yemen who want to give back to Yemen. So that's one pool of trainers. But there are lots of pools that we can tap into and collaborate with and get them on board, and also later on acquire funding for them to come to Yemen as well. InterYem is just like an intermediary as much as an organization that's giving the training. It's about bringing trainers to people who need training in Yemen. So it's a collaborative effort. So, I mean, in regards to the questions we asked earlier about what roles, I think a lot of emphasis has still been on doctors, although Dr. Ala mentioned about psychologists and mental health nurses. And I think one of our colleagues earlier mentioned about having holistic training where people from different job roles train together, which is very important again. So lots of ideas, thank you. If I was to ask you what specialties are the priority for training, I think someone's already mentioned acute medicine, acute surgery, but does everybody else agree with that, or are there other training priorities, for example, infectious diseases, public health?
I think emergency medicine the top priority. Yani now, especially with the figures which we have regarding the infections, I mean, still the main victims are need emergency intervention, as our surgeons mentioned, and we have very big deficit, and we have also a bigger deficit in the paramedical training. So the concentration mainly on the doctors, and while the paramedics are very neglected group of specialty. I think this is very crucial.
I think can also I talk? I think also yes, as Dr. Maher, all the medicine is acute, so we can focus it on the chronic medicine. I think we need more to emphasize about the healthcare system, about the chronic disease. We didn't have good care about the diabetic, hypertension, chronic depression, all these things. This is my opinion.
Any more comments?
Still, Anna, my question to your main speakers, what he can offer us? Yani, straightforward question. Yes. Can you help us to get ERC to Hadhramaut?
RCP,
European Research Council, ERC, European Research Council.
So we use the Royal Colleges of Physicians here. So we have the AORMC in the UK. So I'm not familiar with.
You said you are intermediator.
Yeah. So we work with different organizations within UK at the moment, not necessarily.
Okay. I mentioned you. ARC mainly is based initially it started from UK. Now I don't know. Maybe in Belgium now. Last headquarters for them.
With the Brexit, yeah. So we work with the Royal Colleges of different specialties in the UK more than European.
Okay, Royal College of Surgeons, all of them, they have ARC. They have a center or a chapter at their institutions.
So
this is for sure, definite.
Yeah, Dr. Maher, I appreciate what you're saying. What they want to know is how beneficial will their resources be implemented in Yemen. So if we do approach them, and we have approached them, they want to have proposals from Yemen about the practicability of their training programs in Yemen, and if they are actually useful or not, because they have to allocate a lot of resources and people as well. So we can tap into them. So the answer is yes, but we need to have realistic programs considering the context of Yemen as well, for them to be able to feed into. Does that answer the question?
ERC is it has 9 courses are basic courses in medicine, and maybe now in UAE, and maybe in state, maybe in UK even, are mandatory for everybody to relicense his medical license to practice medicine.
Okay, I think
Okay.
yeah, maybe we've got a slightly different understanding at the moment, because I think in UK we use
Okay.
different training.
So now I request you, look to it. If there is possibility, let's talk about it.
If you could just
And these are
email
basic
me-
courses. Basic courses. Their condition is very easy, not difficult.
If you could email
But
me
this is a program of the training, and this is the successful of any hand-on skill training.
Great. If we can get
Let him to
some,
check. Yeah, and I have already I have access, but I want to hear from him because he's based there. Things will be simplified for us if he's based there and has a direct relation.
this is the start. This is the start.
Yeah, دكتورة إن شاء الله يحفظها. I do agree with her. Like diabetic, like hypertension, yes, it's now a high percentage of this disease. But if you treat properly pre-hospital and acute cases, you will get less number in chronic disease.
No, I don't think so like that. If you treat a chronic well, you will lead to a less acute emergency. This is my opinion from training, from our what we are practicing. If you will manage it, a diabetic patient, or manage it well, you will lead to them less emergency, less surgery. Everything, it will be prevention is more than the curative. This is one of the main role of the medicine.
Great. الله يوفقكم. فعلا الدكتور رشا ان شاء الله يعني متحمسه، وهي اشتغلت كثير معنا في مراكز الرعايه الصحيه، وهي خريجه جامعه حضرموت من اطبائنا اللي نفتخر فيهم، واخذت شهاده الاختصاص اليمنيه في طب الاسره، ثم اكملت الزماله المصريه. ربنا يوفقكم جميعا ان شاء الله، وهي رول موديل لخريجي حضرموت.
Thank you, دكتور.
الله يحفظك يا رب ان شاء الله. أعتقد خرجنا بالكثير، حصيلة يعني كبيرة جدا من هذا النقاش. It is the start, and we have now idea regarding the survey, and we have also clear idea about also the great interim network, and now we know each other. So from now the connection and the continuation of the discussion will start inshallah. And of course, Dr. Mubshir will make conclusion and recommendation after this meeting in order to arrange for the next meeting regarding the further steps in health training priorities in Yemen. And by this, Dr. Mubshir, you have anything to say before conclusion?
Actually, thank you so much. I've learned a lot from our colleagues in Yemen and other countries today. Thank you so much. It will take a lot of time for us to develop structured, realistic training for our colleagues in Yemen. And it will take a lot of impetus from our colleagues in Yemen to come forward as well. Not also just for ideas, but about logistics, about contextualizing it within the Yemeni context as well. To make sure that the momentum continues with our initiative and our collaboration with Yemen, we've been organizing with some colleagues in Yemen about some updates in various different specialties, which will be applicable to our colleagues in Yemen. So we have a series of conferences over the next few months from experts in other countries presenting to our colleagues in Yemen. So if you can just make a note of these dates, you're all welcome to attend. Any job role, nurse, midwife, doctors, everybody should attend if they can. What we really want to do is to have contributors from Yemen as well as speakers, as people who are wanting to chair sessions as well. So if you're willing to do that, if you could get in touch with me, tell us what you'd like to talk about, it'll be very useful as well. I know we're running out of time today, but I just want to give you a heads up of what's coming up in the next few months while we discuss our training agendas in more detail and become more resilient in that sense. Thank you very much, everybody. Jazakallah khair.
Jazakumullah khair. Shukran. Thank you. إلى هنا نصل وإياكم إلى نهاية برنامجنا لهذا الأسبوع 23 بموضوع أولويات التدريب الصحي في اليمن. نشكركم جميعا يا من حضرتم سواء بقاعة الزوم الإلكترونية أو عبر البث المباشر على قناة اليوتيوب أو الفيسبوك. كما نشكر كل من شارك بالمداخلات والأسئلة والتعليقات. نشكر الدكتور عمر الخنبشي من ألمانيا رغم الوعكة الصحية على حضوره معنا وترتيبه لهذا اللقاء، وأيضا الشكر موصول للمهندس أحمد بحشوان. نلتقي بكم جميعا في الورشة القادمة إن شاء الله. إلى ذلك الحين نستودعكم الله الذي لا تضيع ودائعه. سبحانك اللهم وبحمدك أشهد أن لا إله إلا أنت أستغفرك وأتوب إليك، وبالله التوفيق والهداية، والسلام عليكم ورحمة الله وبركاته.